Good afternoon, and thanks for joining us for today's Healthline 3. I'm your host, Courtney Butts, and Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll be taking your calls and answering your questions live in the studio today. We'll be opening those phone lines soon, but as a reminder, make sure you're in a quiet room when you call, with your TV turned all the way down so that we can hear your question. Our number is 318-219-4569, and today's topic is all about getting the most out of your healthcare appointment. And joining me to talk about this is Dr. Antonio Pizarro with Willis Knighton Piermont. Thanks for joining me today.
Yes, thank you very much for inviting me. It's a pleasure.
Absolutely. So explain to me what you do at Willis Knighton.
I'm a women's healthcare specialist. My specialty is a subspecialty of OBGYN. I'm what's called a urogynecologist, and what I focus on is general women's care, but also surgical needs such as urinary incontinence, what's called pelvic floor disorders, where patients have lost strength and support of their pelvic floor after childbirth.
Right.
These are typically conditions that occur later in life, symptoms that occur later in life as a result of childbirth. So most of what I focus on is repair of what we call pelvic prolapse. But I also do general GYN and have spent the past, almost 30 years in healthcare. And so I'm looking forward today to talking about ways that patients can empower themselves, prepare themselves for a doctor's visit. What I've found personally is that most of my patients are really well prepared, and they need very little help from me other than taking the next step to the diagnosis and treatment.
Right.
However, it's I think we all know that going to a patient, as a patient going to see a healthcare provider, whether it's a nurse practitioner, physician's associate, a physician, a surgeon, those visits can be stressful, traumatic, embarrassing, and if we prepare for those visits in ways that meet our goals and that allow us to communicate better what our needs are, the visits go better, and then the healthcare is better after that.
Absolutely, yeah. And so what you do is a subspecialty of gynecology,
Yes.
but you do general things as well.
I do general GYN. I don't do any OB anymore.
Okay.
I haven't delivered a baby or been in the room that I can think of in over like 20 years or so.
Wow, okay.
In any event, what I do is what we would call just general GYN with a subspecialty in urogyn. So in medicine, as most of the audience knows, after college, one goes to medical school. At least in this country, the way it works. In other countries, there's different structures, I think. But we go to medical school, and then after medical school, you can do whatever you want, and you become a general surgeon or a neurosurgeon or whatever, or a pediatrician. Well, what I decided to do was obstetrics and gynecology, and that's a 4-year residency where you're an MD, but you're still training, or DO. And then after that, you can do what's called a subspecialty. And in OBGYN, there's a cancer subspecialty, there is a infertility subspecialty, there is a subspecialty called maternal fetal medicine, which is for high-risk pregnancies. And then more recently, in the past 20 years, we've added what's called urogynecology, which is doing what I focus on, which is pelvic floor disorders. Nice.
Yeah, I love that this is, it's a maybe more recent specialty, and it's very important, it sounds like.
It is, and as far as what I do, very much like most of women's health, it's a very private symptom, very private condition that the patient is experiencing. So we don't hear about it a lot on TV, and you don't talk about it at parties, the kinds of symptoms that my patients experience. And so what I've found over the years is especially in what I do, is trying to find ways to help patients know that when they're speaking to me and my staff, that they're somewhere safe, somewhere that will hopefully foster their ability to have success on their healthcare journey. And those things can be difficult in any medical office. So today we're going to talk about ways to try to navigate that. Absolutely,
yeah. So tell me some of the misconceptions between a relationship between a patient and maybe a healthcare provider.
There's so many. I think one of the most important is that somehow there's an authority difference or a power difference, and I think our culture over the decades, the centuries, has fed into that. One where the physician knows best, or I'll do what sometimes patients will often say, or in one way or another say something like, well, I'll just do whatever you think is best, and the phrase doctor's orders comes in. And there's some truth to that. I mean, we are trained to give the best advice that we can based on the available science. That's all true. However, I always think it's important, and I think most of us in healthcare are, over the past 20 years, have come to adopt what we call patient-centered and sort of a mutual decision-making approach, where patients' needs are at the forefront, and what they communicate as their goals have to be taken seriously, more seriously perhaps than one might think. So sometimes patients might perceive that really we as healthcare providers just say what it is and go with it. And there is some value to that.
Yeah.
But I think that by and large, having a partnership in healthcare is really the way to go.
Right, yeah, and also leaning on, how the patient is feeling and making sure that they are attuned to their body, and knowing like when something's wrong and when to maybe seek help. I think that's really
so
important.
Valuable. That's right. It's when there's aphorisms that we use, and I think sort of throwaway lines like, "Oh, we know our body the best," but that's so true. We really do know what's best. And something else that we'll touch on today is those around us, our loved ones. They know when something's wrong, and it's important to listen to them as well, and to listen to our peers, because yes, like you said, if we know something is wrong, we can detect that. Well, it's common sense that probably there is. You don't want to overreact, and sometimes it's important to, in the process of getting health care, accept some reassurance that something may not be as serious as we thought. But it's also important not to be in denial about things. And so just listening to our body, interacting with our loved ones, and also getting advice from those who are trying to care for us and taking it seriously, and maybe adding to that information with other sources, and so that we can make better decisions for ourselves, is super important.
Right, and so with that, let's say a patient has had a bad experience with a healthcare provider, and maybe they haven't had established care in several years. What's a good strategy for someone to kind of get back into that and find a good healthcare provider?
There's no bad strategy. So that's how I'll lead with that. There's no bad way to find someone to help you. But some of the, I think, ones that the audience will identify with are, especially these days, something we didn't have when I started, was to go to the internet and find someone that has a good rating, good reviews. Now, take those with a grain of salt to some extent, but by and large, I mean, people are people, and when they post a review, and when the physician has a good reputation, these things are something that can be one of the pieces of the puzzle.
Right.
Something else, of course, is any kind of word of mouth that you've obtained, whether it's from a loved one or a friend. I went to see that person, or I sent my kid to see that pediatrician, or I went to, my friend had surgery with that physician. Take that as another piece. Of course, listen, if you have had a private physician, a primary physician that has given you advice, lean on that too. So if my private physician said, "Look, I want you to see an eye doctor. This is the one I want you to see." At first, maybe I don't know who that is, but this is someone who I've already entrusted with my care. They've done well for me. That's who I'll see.
Right.
Why? Because if I pick someone else, if that doesn't go well, then maybe I'll regret it. If it goes well, then great. But I think that we have to, it's not really sort of one event where we pick our specialist. It should be a process. It should be, and the process can be quick. It can be a very quick process. It doesn't have to be belabored. It can be just as easy as, okay, who's the nearest gallbladder surgeon near me? Who's the nearest GI doctor? And that geography matters, and so you have to have good access.
Right.
So it's more of a process and putting different pieces of the puzzle together.
And at the end of the day, doing what's best for you, right? Yeah.
Right. Go with your gut and go with what your needs are. If someone is let's say they're a bowel specialist, but they don't have your needs listed on their website. I don't see patients with chronic abdominal pain. Maybe they're focusing on other things in their specialty. And however, one of their partners might. And so getting in contact with that office, calling and making the phone call and saying, "Look, I've got this need. I've got chronic abdominal pain. Do any of your physicians focus on that?" And the answer might be yes. Or, "I have long-standing symptoms of urinary leakage. Do any of your physicians do that?" The answer is yes. It's not going to be this one or that one, but it'll be this one. We'll connect you with that as a specialist. Right.
Yeah, and I think the first thing is knowing what's going on first, and then kind of establishing a plan from there. So a question that I have is, a lot of people may be wondering, when should I see a generalist or a primary provider or a specialist, maybe like you, or maybe even like when should I go to the emergency room or the urgent care? There's so many different options. So when would be the best time to go where?
That's the perfect way to ask it, because I think if we can start at the top, which is this an emergency? Is this something where I need to be seen right away? Trying to find a way to differentiate that is I think the first step. And that's where, again, trust your instincts, trust your body, listen to yourself. Is this something that can wait till tomorrow? If I call for an appointment tomorrow and they give me an appointment in 3 weeks to be seen, will that be soon enough? Trust your instincts, listen to your family and loved ones. If they say, look, I think you're going to call tomorrow, but you need to be seen tonight. You're not like this. You're not normally hurting like this. Yeah, you have headaches, but not like this one.
Right.
I'm telling you, so listen, I'm dramatizing that a bit, but it's to point out that that's the pyramid, at the top of the pyramid is an emergency. Aside from that, the short answer is I think it's super valuable to see your primary provider whenever possible for several reasons. Number one, it's very likely that provider will have the answer for you in most cases. They'll have a strategy that they can manage, even if it's a procedure. Often they'll be able to provide that for you personally. That allows you for ease of access, someone you already know and trust, and finally someone that knows you well enough to provide, if it's a procedure that they do personally, they can they've already got that relationship with you. On the other hand, if that specialist says, look, this is beyond my training, they might be able to tell you that over the phone. If I call my primary provider and say, I'm having, whatever, and they say that's not something I can help you with in my office, make an appointment for, I'll send you to a specialist. Now, as far as personally picking a specialist, that depends on the condition. So for example, if I had a really bad headache and it wasn't going away, I don't know that I would personally make the choice to call up a neurosurgeon, because it might be something, maybe I need to see a dentist, maybe I need to see, so that's me knowing a little bit more about the fact that, people with dental conditions can get headaches. It seems like a common sense thing as well. In any event, we have to use our judgment in those things, but I think discerning what's an emergency and consulting with the primary physician, I think that's the best, a good start to the strategy. Yeah,
good advice there. Okay, well, we have Benedict on the line. Thanks for joining us. And what is your question today?
Are you going to talk to me?
Yeah, what's your question?
Okay, here's what I need to know. First off, I'm a veteran. I've got severe lower spinal stenosis in my lower back, 8 inches my lower spine. The vertebrae are swelled up 3.5 times the size of a normal vertebrae, and from the waist down, it's slowly shutting me down. What I want to know, can it be possible for a hypnotist to hypnotize me and tell me the pain's gone?
To hypnotize you to tell you what? I'm sorry, I missed the last part.
The pain is it's not there no more?
I don't think I understand the question. I think it's about whether hypnosis might be helpful for that condition. I think that touches on an important topic, which is the idea of alternative medicine. And we have found over the past 3 or 4 decades that many what we used to call alternative medicines, or sort of medicines outside of what would normally be prescribed by a physician or a surgeon or a medical doctor, have come to the forefront and have become more valuable. So the answer to your specific question is, best answer I can give is I don't know. However, I think it's always worth a try. And if you do something like that pursue hypnosis for care, we know that hypnosis can be valuable in patients who are trying to overcome addiction, trying to overcome pain, and I think that's no question part of what could be a group of treatments for you. I will say that in doing so, I would definitely consult with your primary physician. And if you're having back issues, especially, I think Benedict said spinal stenosis, that can be a surgical problem solved by a neurosurgeon or an orthopedic spine surgeon. So definitely keep that in mind. I will add that to be more to illustrate the point, I don't deliver babies anymore, but when I was doing that a long time ago, one of the things that was actually studied was acupuncture for pain relief during labor, and different forms of acupuncture and were being seriously studied. Now, I don't know where that is now. I will say that in my specialty there is a form of acupuncture, and I always tell patients about this because it sounds kind of hokey, but it's legitimate, and it's now advanced in the science, where we used to think of acupuncture as this sort of non-science or fake medicine. Well, there is a very advanced form of acupuncture, and I'll point out briefly that patients who have really bad urinary incontinence, typically women, I don't know that it works for men, I don't treat men, but who have really bad urinary incontinence that have tried different medications and maybe other procedures, where a needle, very much like an acupuncture needle, looks exactly like one, is placed in the ankle, and an electrical signal is not just the needle, but an electrical signal is sent up the nerve to the leg into the spine, and it calms the bladder.
Wow.
And the different form of that is an implantable form where a little battery is actually put at the ankle. So that's just to point out that we should never discount something that might be helpful. If it's not going to hurt, it's worth a try.
Yeah, and always consult with your primary provider or your specialist before doing so.
And I'll add that treatment I mentioned with the needle is not experimental. It's FDA approved.
Nice.
It's been something that if you'd told me 30 years ago, we're going to put a needle in your leg and treat your urinary,
that's crazy.
It might have been in its early stages at that point. I don't know that as far as the science, but it's legitimate.
That's pretty cool. Awesome. Yeah, well, if you're just joining us, we are talking with Dr. Antonio Pizarro with Willis Knighton Piermont, and we're talking about women's health and also, the strategies for, going to see your healthcare provider, and when should you see a specialist and when should you see your primary care. And so how can people prepare for your healthcare appointment? How can they get ready for that?
There are several parts to it. I think probably the most valuable part is having a clear understanding of what a patient's needs are and what the patient's goals are. Sometimes that may not be clear. It may be just as simple as, I just don't feel right. I just want to feel better. That's good enough. I mean, that's very valuable. However, when it's an appointment, and that might be more of an emergency situation, but in general, patients often go for routine care or for general management, and they have a need that they feel like, look, I've got this elbow that's hurting me. I've been managing this on my own. I need something better than this. I'm tired of wearing this brace. It's about time I got some help. And so a good way to prepare that's the first step, is know what it is that I feel I need and be able to communicate that in the best way I can to my healthcare provider. Another thing to do is to prepare questions. And my hope is that by the time the physician and the provider and the patient have done talking in the first few minutes, that many of those questions are answered. But prepare a list of questions. I love that when patients come with literally handwritten notes or typed out notes, because it's valuable. That means they've had a chance to be clear on what they need, and then if I haven't answered their questions in the course of discussion, they can follow up with additional questions. I can't tell you how many times patients have said something like, I know you guys hate it when we look stuff up on the internet. I don't think most physicians do. I think that's something that's been put into TV shows and that sort of denigrates the idea of patients. And that joke that says I looked up on the internet just enough to know that I'm dying or something.
Right.
Like
Yeah. Like WebMD it.
Exactly. But that is helpful, because now sources like WebMD, MayoClinic.com, the CDC, womenshealth.gov have really valuable information. And it's not perfect. Nothing is perfect. But to answer the question, what can we do to prepare?
Yeah.
If we have things that we've thought might benefit us, that give us a better understanding, researching them or I guess looking them up on the internet is also valuable and can add to the way that patients communicate with their provider.
Absolutely, and it kind of helps you to help them to maximize their time when they are in their appointment. And so what are some questions that maybe patients can ask? Like, what are good questions that you think can help them maybe feel better about their specific diagnosis?
I think that this is always going to come from the patient themselves. So you know yourself best, and there are things that I might want to ask that the next patient may not have any interest in. But in general, some good questions are, how do you know that this is going on? So I always tell patients, if this is my advice, someone else might give you a separate set of advice. And if theirs matches your needs better, that's great, but be sure that they can clarify to you exactly how they know that that's better than what we've discussed today. Of course, I always welcome that. So how do you know this? Like, what makes you say this? You can even word it that way. How do you know that that's what's going on? Another good question is, are you sure? Are you sure this is what's happening? Have you done this before? A good question is, have you offered this kind of treatment before to your patients? Another good question is what we're doing, what I'm experiencing now dangerous? And I think that's a valuable question, because some things can be concerning, worrisome, but not dangerous. And so the reason I say that is, another question to lead to the next question is, what if I don't treat this? What if I leave it alone? Because non-treatment or not intervening is not non-treatment. Because if we leave it alone and watch it, keep an eye on it, that's still medical care. And that might be appropriate. So those are several specific questions. And the good news is that very often one question leads to another, and those are the best way to open a conversation with a patient.
Yeah, especially probably in your case, you're talking about surgery, and sometimes that can be worrisome, but it's not necessarily, like you said, a dangerous procedure. It's something that you've been doing for a long time, even with robotics for almost 20 years, I guess. Yeah. So you can also, it gives you an opportunity to put them at ease as well, knowing that, like, hey, I've done this before. You can be put at ease knowing that this will be the best thing for you and your care.
That's right. At least it helps offer that. If it's not a perfect, if I can't put someone completely at ease, then no one's perfect. But at least we can strive for that. And you're right that if it's something that someone has been doing for a long time, that helps and sort of arm the discussion with facts and science. That's not always possible. Sometimes things are done based on experience alone from the provider. Also, things that might match what a patient is voicing. I really want to get better, but I definitely don't want surgery. Maybe surgery is the best thing or the most likely to lead to relief. But if we can defer that, especially if that's what the patient would like to do, then we have to try to meet the patient at where he or she is.
Well, let's talk a little bit about what you do at Willis Knighton. So you subspecialty under gynecology, and you're helping with the pelvic floor, women's health. Tell me a little bit more about that.
The pelvic floor in both men and women, but and I don't treat men, but in both men and women, the pelvic floor refers to the muscles, connective tissue, blood vessels, and nerves that support the pelvis, that are under the pelvic organs. In women, of course, it's the bladder, the vagina, the uterus if they haven't had a hysterectomy, the rectum, and of course the intestine that rests there as well. So if you, when we think about the pelvis, there is, we just kind of use that word and we often think of the pelvic bones, but it's the pelvic floor refers to really the connective tissue suspended within those pelvic bones. And pelvic floor disorders refers to a group of symptoms and signs and things that can be seen that typically, I'm not going to say always, but typically occur as a result of childbirth. Not always, but typically. And in my specialty, what I think the lion's share of what I manage is what we call pelvic organ prolapse, or loss of support of the vaginal tissue. And this is a condition that can be quite uncomfortable for women. It affects a large percentage of women. As many as 40% of women have some degree of pelvic floor disorder, and as many as 11% of women can end up needing a surgery to correct it. So it's quite a common condition and set of treatments. And I also address symptoms like difficulty with menstruation, painful periods, heavy periods, and provide procedures to manage them as well.
Awesome. Well, we're putting a pin in that, but we've got Gladys on the line. Gladys, what is your question?
Yes, I have a severe bladder leakage. I guess I could say it's so bad it's like I do not have a bladder. It's just, it's just no control. And I wanted to ask the doctor, what kind of treatment is done for that?
The best answer is, thank you for your call, Gladys. The best answer is that it depends on exactly why a patient is leaking. And for the most part, that can be managed conservatively. And by that I mean without surgery. Depending on exactly when a patient has leakage and what causes her to leak, how long it's been going on, what other treatments have been tried, you can start with something simple like pelvic floor exercises or getting your pelvic muscles stronger. And there's actually very good instructions believe it or not, on the internet, like at mayoclinic.com, and Willis Knighton Health System actually has a really good health library where you can find exercises that in most patients will strengthen the pelvis and improve urinary leakage. So that's always a good start. If it's debilitating leakage, something where it's clearly been going on for a long time and it's limiting patients' abilities to do anything, and that does happen, then I think seeing your primary provider is a good start, because sometimes they can recommend things like medications and might need to refer you to a specialist to have that managed.
All right. What's your phone number, sir?
Phone number.
Your office number.
Oh, thank you. My office phone number is area code 318-212 3680. 80.
All right, sir.
Mindy or Erica will be happy to talk to you.
And I didn't get your name, doctor. I guess part of the information. What's your last name, doctor?
It's Pizarro, Antonio Pizarro.
It's right there on your screen too, if you wanted to copy that down.
All right, and that's in Bossier?
My office is in Shreveport, but I see patients from everywhere.
Oh, okay, your office is in Shreveport then. Okay, I usually go to Shreveport for medical problems. So I can just call this number and they can direct me to your office?
That is my office, yes. That'll work.
Okay, that's 3682.
212 3680.
3680, okay. Okay, I put 2. All right, so you mentioned something about exercises you could get off of, did you say YouTube?
Yeah, you could. If you use YouTube, then if you go to YouTube and go to a trusted source, if you look in bladder exercises or pelvic exercises, be careful with those things, but but YouTube is a very good resource for medical care, and of course I'd trust you to decipher the best source for that, but there's some really good ones on YouTube as well.
All right, well, thank you very much, doctor.
Thank you.
All right, thank you for joining us, and we have just a couple minutes left, but it's very interesting that you said 40% of women struggle with pelvic floor issues, or is that what you said earlier?
Okay. Yeah, of one kind or another, for sure.
Right, and so take me through kind of the spectrum really quick, but when should someone worry? Is it painful? Is it something like maybe that Gladys is experiencing, that maybe there's pelvic floor disorder? And then what's next from there?
It really, the types of symptoms vary, and they can range from urinary incontinence that's just a little bit, all the way to urinary incontinence that can be debilitating. It can range from a feeling of pressure and fullness because of loss of vaginal support that's mild, all the way to something that patients feel constantly and is very bothersome, limits their ability to sit. They can't walk comfortably because they have a great deal of loss of support in the vaginal tissues. And it can also be things like bladder pain, which I don't deal with bladder pain a lot. A lot of urologists tend to focus on that, but bladder pain is something that is also one of those symptoms. And so the treatments range from exercise to surgery, and believe it or not, diet. We were talking off air about diet. Diet is actually an important part of managing many of the pelvic floor symptoms. And of course, if someone is going all the way to surgery, surgery should be carefully considered, is rarely emergency. Most of the time, some of the more conservative treatments have been approached.
Gotcha. Wow. Yeah, so that's a very interesting topic. Maybe we'll have you back and we'll talk a little bit more about that. We have just about a minute left, so tell us, you just gave us your phone number. Tell us where we can find you, if on your website, your phone number, and where you're located at in Shreveport.
My office is located at Willis Knighton Piermont, which is at 8001 Uri, and my phone number is 212-3680. if you go to the Willis Knighton Health System, if you just go to Willis Knighton Health System and navigate through Find a Provider, you'll find a list of a bunch of great providers, but I'm in there. And
cool.
I don't remember I think it's just willisknightonhealth.com if I'm not mistaken. And I just put it in and it's already there.
Yeah, right.
And my website is in that system, is in that search. And I look forward to hearing from anybody that feels like I can help them, and I hope that we've had some good conversation today.
Absolutely. Thanks for your time, and thanks for joining us. If you missed this, you can catch this on ktbs.com/Healthline3.